Hello everyone, my name is Ariel Gomez and today I'm excited to be sharing my findings from my qualitative research study exploring how ADHD symptoms influence the nutrition behaviors of college students. We all know college can be a challenging and stressful period with a crazy schedule and limited funds. If anything, we know college students are notorious for not eating healthy and for living on ramen during this time. While studying college students was all well and good, I wanted to see how ADHD adds unique challenges during this time. This project aims to investigate the unique effects of ADHD on the dietary patterns and nutritional intake of college students. I hope to use this information to develop nutrition education that may be more effective for students with ADHD, as well as provide some recommendations on how to improve structural and environmental barriers and support. Starting off with my purpose statement, the purpose of this research was to explore how executive dysfunction and additional factors influence food choices and eating habits among college students with ADHD. The goal was to examine these behaviors not just through an individual lens, but to identify the patterns related to social determinants of health in order to improve nutrition education and interventions aimed at students with ADHD. I gathered my data by conducting individual key informant interviews and a focus group with students that had ADHD. This research is relevant because of the current gap in studying college-age adults with ADHD and the impact of their symptoms in adulthood. ADHD impacts executive function, influencing dietary behaviors in addition to environmental influences. And because the research in this area is lacking for this population, I believe it is important to study. Moving on to my study objectives, my primary research question was asking how ADHD symptoms affect the eating habits of those with ADHD and how general healthy eating advice and recommendations could be adapted to more effectively counsel students with ADHD. Because we're using the framework of the social determinants of health, I focused on three determinants, and those are economic stability, accessibility in the built environment, and social support. I really wanted to investigate how ADHD symptoms interacted with these determinants to impact their dietary behaviors and their health outcomes. The motivation of the study was to bridge a gap in applied nutrition and neurodiversity research. Much of the research available is focused on ADHD's impact on the dietary habits and taste preferences in male children. However, the current research is limited in adults, with much of the research being focused in male adults. This could be due to the significant impact that ADHD has on academic performance during the school years, and the outdated belief that children will eventually outgrow many of their ADHD symptoms. As we are learning with more and more research, that's not necessarily true. And unintentionally, this research has helped me bridge the gap in studying the challenges in female adults who are affected by ADHD. This really surprised me during the recruitment process, and when I saw that they were all female, I was really excited to hear about their experiences. So continuing on with my methodology, I had to change my recruiting process a couple of times due to not receiving responses. I originally intended to collaborate with the Bronco Student Wellness Center, but unfortunately I never got a response from their manager. So then I pivoted and I tried to recruit students from Glendale Community College while I was interning there, but unfortunately there was a mishap with my scheduling, and I was scheduled during winter session and there were not very many students available. So ultimately I was able to reach out to some of my old nutrition professors at Cal Poly, and I asked them to help me with my recruitment, and thankfully Professor Yokoba was able to send me some students. I was contacted by 3 female students aged 19 to 21, all with ADHD. I provided informed consent via Google Forms and for both the interviews and the focus group. I conducted the key informant interviews individually, and they were semi-structured interviews that were held over Zoom. I did do one in person just because that made her feel a little bit more comfortable. And during these interviews, we explored themes like food planning, hunger regulation, and barriers to accessing healthy food, especially while on campus. And in the focus groups, we included the same students from the key informant interviews, and the focus group was a semi-structured discussion held over Zoom discussing like the barriers that they had to being successful in consistently eating healthily, as well as strategies that were helpful for them. Continuing on to my data analysis, I began with open coding to identify the initial concepts that were present in the transcripts that I got from Zoom. I then used constant comparison and axial coding to group those initial concepts into themes based off what the participants were sharing about their routines, barriers that they were facing, and adaptations that they were making. I wanted to focus on the determinants of health that I had chosen, such as the accessibility in the built environment, financial stability, and social support. Through this lens, common patterns emerged around time blindness, disordered eating, and limited access to healthy food, and the role of social influences. The analysis I did revealed how ADHD-related executive dysfunction is exacerbated by those social and structural barriers, particularly those related to our social determinants of interest. And it seems that those barriers really shape the dietary behaviors of college students with ADHD. Continuing on with the perceived barriers, the participants were able to describe several perceived barriers to healthy eating, which aligned with both ADHD-related challenges and the broader social determinants of health that we identified. I was able to categorize these barriers into structural, psychosocial, and behavioral categories. This graphic provides examples of the perceived barriers that the participants had related to their ADHD symptoms and behaviors. They believed these impacted their ability to consistently make healthy food choices and meet their health goals, which was in line with the literature. And then, as we can see with this graphic, all of these are related to executive dysfunction and all have a significant impact on the food choices that these students are making. Moving on to themes and codes, 3 key themes emerge from the data. The first theme was that there are environmental and structural barriers on campus that made healthy eating difficult or unappealing. The students reported several major obstacles in their campus environment that made it difficult to maintain their healthy eating goals. And these challenges included poor quality campus food, the lack of kitchen facilities in the dorms, and the limited availability of affordable, nutritious, and filling meals. The next theme that emerged from the data was that executive dysfunction was a significant barrier to consistent eating. And this theme captures how symptoms of ADHD like time blindness, burnout, and impulsivity affect the participants' abilities to eat healthily and regularly. The students also reported struggles of being able to stick to structured meal times due to their symptoms of executive dysfunction. And they also consistently described how their ADHD-related challenges such as forgetfulness, difficulty starting tasks, and decision paralysis often interfered with their ability to plan, prepare, and consistently eat nutritious meals. Even when these students had nutrition knowledge, because a couple of them did have basic healthy eating knowledge, they really struggled to put it into practice because of these challenges that they faced with their ADHD symptoms, in addition to the environmental and structural barriers that are in place. The last theme that emerged was that emotional and impulsive eating patterns can complicate nutritional goals. All of the participants had reported frequent emotional and impulsive eating, which was often triggered by stress, boredom, or just being surrounded by highly palatable foods. And their ADHD symptoms, particularly the impulsivity and the sensory seeking, seem to contribute to inconsistent eating patterns, late night eating, and difficulty following through with the nutrition goals that they had set for themselves, even when they had the best of intentions. And then additionally, the lack of social support or environmental support really increased the likelihood that they would give in to emotional or impulsive eating behaviors. So with those themes in mind, let's review some of the key findings from the interviews and focus group. So from the interviews, I learned that the students were often skipping meals and had to rely on easy to access snacks due to their ADHD symptoms and the demands of their scheduling. This caused disruptions in the structure of their meal patterns as well as their ability to prepare and plan and execute food preparation. This caused them to rely on snacks, like often because it was more low effort to choose the snack than to create a balanced meal. And this was compounded by the fact that there is limited healthy options available on campus, and in addition to some concerns over food safety and food safety training, and just a limited access to kitchen space in the dormitories and apartments. From the focus group, these issues were also repeated again. The participants reported high food costs and transportation issues being major barriers to accessing healthy food options. In addition, they noted that social settings and their social support from their social network often undermine their desires to eat healthily, and if anything, encourage unhealthy eating habits, such as one of my participants, she's a babysitter, so she frequently just eats what the kids are eating, like pizza and cookies and things like that, and she finds it difficult to actually stick to her eating goals. And then in addition to that, there's the environmental barriers that reinforce executive dysfunction. So, the busy scheduling, having to have class all day, so that they need to have reminders, or not having a lot of time in between periods, and that just exacerbates the symptoms that a lot of the students were feeling. And moving on to interpreting these findings, I believe that my findings support my hypothesis that ADHD-related executive dysfunction is really exacerbated by the systemic, environmental, and structural barriers that are just built into the college environment. And this results in not only students with ADHD experiencing dietary challenges, but college students as a whole. And that's why I believe that it's really important to address the barriers such as cost, structure, the food preparation burden, food safety, as well as social support in order to improve the health status of college students, especially since this is a really stressful time where people expect to gain extra weight because they're in college, or because they can't afford more nutritious foods, or they just don't have the time to prepare them. So whatever the university can do to help support students that live on campus, I believe is in a good direction to move in. And because of that, I think it's important to develop strategies that are flexible and ADHD friendly, so that way we can provide those structural and environmental supports to help students make healthier choices. I believe my findings indicate the need to address these challenges and barriers outside of just improving nutritional education and counseling for ADHD students. The following examples would address the social determinants of health that we have been focusing on. This includes financial support for healthier food options through subsidizing healthy meal options, improved campus food infrastructure by increasing the amount of low-cost healthy snack options, and promoting the increased utilization of produce from Cal Poly farms to reduce food costs. Additionally, built environments should reduce, not add to, the cognitive demands of food access. Structural supports from the college could improve the health status of not only ADHD students, but of all students who are living and dining on campus. Lastly, social support should be created to help students eat more healthily during their college years. This can be done through improved peer education, campus-based ADHD nutrition coaching, and as well as peer and family support. And so I make the following recommendations. In addition to improving nutrition education and health activities that are targeted at students with ADHD, I think there are other things that Cal Poly can do to improve the dietary habits of the students that are living on campus. This includes collaboration with CAPS, or the Bronco Student Wellness Center, to offer executive function coaching, as well as social support that we can provide to students, but in addition to encouraging students to utilize their support network, such as their family and friends. Unfortunately, this isn't a reality for all students, so it's important to also refer students that do not have this kind of social support to resources that we have created that would provide that kind of social support. In addition, we want to educate students on how to create their own structures, such as timed reminders to eat, visibility cues, and meal prep methods that are realistic for people with ADHD. Lastly, I think improving environmental support is crucial. While individuals can attempt to make changes on their own, they are highly influenced by the environment that they live in. So I believe it's important to improve food safety by training food service staff, and also by supporting the transportation options to be able to go to local grocery stores, as well as promoting the options that are available on campus, such as the Poly Pantry and the Vista Market. Before I conclude, I did want to go over some of the limitations of the study and a bit of self-reflection that I have done. Probably the biggest limitation of my study is that I have a really tiny sample size of only 3 people. I can't really be making any broad sweeping generalizations from this, but I believe that it provided a lot of great data that we wouldn't have gotten through like quantitative data collection methods. So I still believe that a lot of the insights were valuable to illuminate some of the challenges that students with ADHD are facing while living on campus. And to reflect a little bit on how I could have done better, I believe that I could have been a little bit better in my bias. I admit I already have an interest in ADHD and nutrition research and how that impacts things. So I had to make a really conscious effort to not try to lead the participants in a certain way. And I really had to work on my active listening skills. So that way I listened instead of while I did want to have a bit of conversation with the participants, I wanted to focus more on what they were saying to me instead. And it did make it kind of challenging because of that. And so I had to learn how to do more open-ended questions and be better at active listening. So that way, it would allow the participants' data to emerge rather than the stuff that I am leading them to. And I really did feel like I was able to capture some of the specific nuances related to ADHD and behavior, like sensory food aversions, having to rely on visual cues, like the meal skipping and the challenges with disordered eating due to symptoms of executive dysfunction. And these are not typically things that get asked during a nutrition assessment. So I feel like this really helped provide a lot of great insight into how we can better support students with ADHD. And I would like to move on to our conclusion. So in conclusion, ADHD affects how students eat both biologically and behaviorally, and these impacts continue into adulthood. We've also been able to identify that social determinants of health like income, food access, and social support have a major influence on the dietary habits of those with ADHD. And because of this, it is important to develop interventions that are inclusive and responsive to the neurodiverse brain and the environment. I really appreciate you for listening, and I welcome any questions and discussion that you may have. I found this project to be very eye-opening into a lot of the struggles that I may not have considered outside of how executive dysfunction affects nutrition, and it's given me a lot to think about.